For 70 years, SGMC Health has been more than a healthcare facility. We've been a cornerstone of care, compassion, and community in South Georgia. Now we're building on that legacy with groundbreaking growth, a bold $25 million campaign to shape the future of healthcare. $1 million dedicated to compassionate care, from the very first heartbeat to life's final chapter. $1 million establishing a strong endowment, ensuring long-term sustainability and future growth. $5 million fueling innovation and education, training tomorrow's caregivers today. $5 million directed to specialized medical services, so expert care is always close to home. $13 million expanding access, so every family gets the care they need when they need it. From that first delivery in 1955 to the thousands of lives we touch each year, we've remained committed to delivering exceptional care close to home.
My mother, in March of last year, had a cardiac event, and the first responder there was the Berrien County Sheriff's Department. When I arrived on scene, Ivy was giving my mother CPR. There was no AED available because our police department didn't have it, our sheriff's department didn't have it. After that event happened, we decided as a family that we wanted to change that situation for Berrien County so that our first responders, particularly our sheriff's department and our police department, would have availability to AEDs. So maybe that outcome could be different for somebody else.
My Mimi was very generous, and she was very proud. We talked about this at her funeral, to be from Berrien County. And I just thought it was really special that we would be able to honor her memory in a way that was going to go on to continue to help the county, after she was gone.
The Cancer Center is fabulous, and it's nice to have it here. I have a son with special needs. My youngest one is autistic, so his schedule is really important. And if I were to have to travel to Emory or to Mayo, just constantly finding childcare and not being home at night with him would be more of a burden than anything. So having the Cancer Center here really has been a game changer for us, yeah.
We didn't know what to expect, how long we were going to be able to keep her in the room with us. And all of a sudden they bring in the cuddle cot and we're like, oh, what's that? And it's the cooling system where you can keep the baby with you, and just having that moment and time spent with her, we could never get that back, can't get that time back. And so the cuddle cot gave us that and gave us that time with her.
In the process of the cuddle cot coming out, it was actually not working. And we were kind of concerned at the moment, like, okay, if I can't get it working, what happens next? And so, I was like, well, and we asked the staff, like, would y'all have another one? They're like, well, unfortunately we don't. But I could only imagine, like, us being in there and someone else having a situation where they want to have the same, extended time with their baby, and gotten with Hillary with the foundation, and we're like, how can we make this happen? To get one of these donated, or multiple if necessary, if we can raise the money for it. But we wanted to do one in Joey's name, and that was one thing we wanted to do to honor her.
With this simulation equipment, we're able to train physicians at the next level. In our simulation lab, we'll have high fidelity mannequins that can breathe, bleed, and be operated on with real-time feedback. All this is integrated with virtual reality so that we can teach these life-saving invasive techniques in a safe, controlled manner.
I think I speak for every resident physician here at SGMC Health whenever I say how blessed and grateful I am to have this sim lab experience to enhance my residency training. And my hope would be that every contributor to the foundation knows that they're directly playing a part in our training and development and becoming exceptional physicians.
My grandmother, it was a couple years ago now, but she was living independently. She started to have anxiety about a lot of things, like taking care of herself, and Dogwoods was such a blessing. It allowed her to go somewhere temporarily. They could monitor her daily. So we were assured she was getting 3 meals a day, and she was getting the meds that she was prescribed. That security she found in not having to worry about anything. Anxiety had just
really taken a toll on her at that age. And now she feels very blessed that she doesn't have to worry about that. So it was instrumental, I would say, in our life in helping her transition from that independence to needing some care and her wanting that care.
Alongside these incredible stories, lasting impact also depends on thoughtful planning for the future. A $1 million investment to establish a strong endowment will help ensure that the care we provide today can be sustained for tomorrow. This permanent fund offers a reliable source of income, supporting services, outreach, and innovation regardless of future challenges. This commitment ensures our community can always count on exceptional care close to home. Here's to 70 years of healing, hope, and heartfelt service, and to the future we continue to build together.